talk is about, and this talk is for you. Today, you're going to learn about Africa and what it is to give birth there. You're going to learn that despite fancy customer journeys and funny post-it sessions, service design can be also pretty serious. You're going to see that design has entered and it's finding its role in a field that previously has been reserved to research and development. Finally, you will learn that saving lives is not only a doctor's passion, but can also be a designer's passion. And I hope with this talk, I'm going to inspire you to think that each and every one of us with our crafts and skills can contribute to making this world a better place. So, every day, 800 women die in childbirth. This is over 200,000 lives lost a year. I need to use the clicker. More than 2,700 children die every day within the first day of their lives. That's close to 1 million deaths per year of children. 99% of these deaths happen in low-resource settings, those settings that we have been already acquainted to in several talks today. Here's the catch. 89% of these deaths are and would be preventable if conditions for women giving birth would be better. So you might think, what are these conditions and why are these numbers so high? So there's a lot of barriers for women and their families in low-resource settings to access good quality of care in facilities. We have transportation. As you can see, a lot of women actually go to the facility on a motorcycle and end up in terrible car crashes and accidents. Sometimes there's no transportation available. Access to money. In countries with high corruption and little resources, a lot of people need to pay a lot of money to access good quality of care. Trained staff is another barrier really often. The lack of supplies such as medicines, even beds and hospitals that are big enough is a challenge to deliver good quality of care. And finally, hygiene is also a big aspect of that. So these are all kind of very tangible aspects how quality of care could be improved. Sorry, this was now the wrong way around. But there are also a lot of intangible aspects of quality of care that has been researched, and we know that they have a huge impact on the outcomes of birth. We have a lot of traditional myths and harmful beliefs among these cultures about giving birth. So using of herbs and thinking that praying and praying to different witches and gods may help to deliver a healthy baby. We have the fear of stigmatization, such as fear of HIV and so forth. We have lack of male involvement in cultures where men really are not part of this whole journey of becoming pregnant and delivering a baby. And then finally, we have the disrespect and abuse among health workers towards women. So that means that women who come without supplies, without money, without knowing what is to be expected, they are being shouted at, pinched, slapped, and mistreated, sometimes really, really badly. So you may think, like, what can service design actually bring in such a setting and to such a big challenge? In 2013, the Reproductive Health Department of the World Health Organization, with funding from the Bill and Melinda Gates Foundation, took a big leap in collaborating with us creative thinkers and service designers to explore what are tools and services that actually could help improve the quality of care, help families and women demand better quality of care, and empower health workers in the facilities to deliver more women-centered care. And you know that WHO is an institution whose job is to create guidelines about how care is delivered worldwide, what needs to be in place. But we know also that in these settings, in these low-resource settings, international standards and guidelines don't really help if there are no beds available, no facilities, and no trained staff. So they went on to a journey to define that let's go from international standards of care to negotiated standards of care by asking health workers and women in these countries to think what is their needs with respect to care, how can they deliver better care. At the same time, we wanted to look at how can we move from just clinical practice towards more women-centered care. And how did we do this together with the World Health Organization? The World Health Organization conducted a formative research in order to inform the standards of care, to identify what should be in place, what is the minimum standards, what is the minimum common denominator that we should have. And then the service design team looked at how to do actually that. So how do we bring these standards in so that then women understand them, can demand them, and so that health worker can provide them. So that means we had to look at the expectations, needs, preferences, the ways of communication, how decisions are made, what kind of behavior drives action, what are the interactions, and what is the information flow. It is very common in low-resource settings that people can deliver you a big bucket list of problems. And how we as service designer could add value here is that we actually don't look at this bucket list of problems, but help people to come up with new solutions and ways to actually solve these problems. So what did we do? We did design research and co-design in Uganda and Nigeria for the past 1.5 years. We went to different facilities and communities. We observed and talked to a whole bunch of people, I think over 90 people, doctors and nurses, pregnant women, women who had delivered, fathers, religious leaders, both from Muslim, Christian, and other religions, and other stakeholders, such as mothers-in-laws, and talk to them about their experience, preferences, worries, and needs towards giving birth. And we actually had quite a big challenge and quite a long customer journey, because the journey of a woman giving birth is over 10 months long. So there are quite a lot of touch points, barriers, opportunities, needs, and challenges along the way. We had to map, what are these touch points before pregnancy, during pregnancy, when the woman goes into the facility to get her routine checkups, and then finally when she arrives to the facility, how does she get there, what happens upon arrival, what happens in labor, how is the baby being delivered, what is being done after delivery, and what happens when she returns into the community. So with all this research, investigations, observations that we did, we came up with a few guiding principles that we wanted to integrate into our solutions. And to cut 1.5 years of design research and design short, this is in summary these principles that we felt we wanted to apply. So the first one is a story that can be told. We felt that there is a big lack of women to understand why they should go to routine checkups, why they should go to the facility, what happens at each checkup, what happens at birth, what do I need to bring, how do I need to prepare, what decisions do I need to make. Women don't understand what is a C-section and why a C-section might be the only way to deliver your baby. There's a lot of misbeliefs and misunderstandings with regards to what clinical practice is actually needed in emergency situations. We needed to create positive messages for positive outcomes. There's a lot of negative stories that run in the communities and in the facilities with regards to care. So we thought that why is everything so negative? Why are there so many do's and don'ts and just warnings and threats? So we need to create a message that's positive, a story that creates an excitement towards better outcomes. We needed to make the pregnancy real for the couple in order to involve men in this journey. So how can we make the pregnancy visual and tangible for the couple in order to see that pregnancy actually needs attention? We wanted to convey that prepared is actually the way to be strong during delivery. It's not about physical strength when you have to deliver a baby, but it's actually on how well you are prepared when you go in to deliver. And finally, we needed to look at what information actually leads to action. There's a lot of information that is accessible to these people, but it doesn't lead to any action. So how can we actually help to do that? So what we came up with, and yesterday we heard already in the talk how important service branding is in making a service come to life. So I want to start with our brand story and how we imagined the journey of the woman towards better outcomes. We thought that the biggest goal and the kind of result and the way how we can measure that women actually have had a successful delivery and they're happy and healthy is the smile of the mother towards her baby when it is born. But it's also the smile of the midwife when she arrives to the facility to give birth, to welcome her. So the smile is a bridge to connect people. And it's the first step in negotiating and willing to collaborate towards a better outcome. And it's not only the health workers who have to do a better job, it's women who have to be prepared, it's the men who have to participate, it's the whole community that should come together for healthy and happy mothers and babies. So this is our branding or initial branding to create a new message for women and their families and health workers in the communities, that it is not only the health that counts, it's not only survival, but you also need to have a healthy and happy delivery. So we created a service journey, and this is how it then translates into our service prototypes. We created a new journey framed around these smiles. Can somebody put that off? Hello. Let's skip this version. So along these journeys, in order to create more action and activity among the couples, you can see these yellow stars. So each phase of the pregnancy and delivery is connected to actually a celebration ritual where the woman has to, can sit back and relax and enjoy and be happy that she has achieved something in the journey towards a healthy and happy baby. And innovation does not always mean that we need to create new technology. But we actually have come up with a set of paper tools right now, simple as these little badges that we are wearing right now to improve the quality of care of women in the facilities. We have a Healthy and Happy book, which is the book that introduces the mother and the journey and all the activities that lie in this journey towards a better delivery. How she gets prepared, how the husband can contribute, what happens at each visit, at a checkup, and what happens most importantly during the facility. We have the mother's pass, who she wears around her neck, that communicates the key information about her in the facility so that midwives know what are her needs, which phase of labor she's in, and what kind of treatment she needs to have. We have the supporter pass for the husband or the companion who is in the facility so that he has a clear role to play in supporting the woman delivering. There's a checklist and several good tips for him to help him support her in the way that he best can. We have a pregnancy band that is a long measure tape that helps to make the pregnancy real. You can put it on your belly and see in which week how big the baby is, to get engagement within the couple, to talk about there is actually a baby here that needs attention, and we need to prepare for that. And then we, of course, have in the facility, we have things like name tags, to have the midwives introduce themselves so that we actually start the care with a smile. And finally, we hope that this could become a label for the hospital to say that here is where healthy and happy quality of care is delivered, and we all buy into this system. So what we've learned, and I'm already running out of time very quickly, is it's not these final tools that we design, it's the journey that is the change. It is how we engage people in the discussion of how we can actually change things with little steps, such as a little paper that shows some information. Everyone has the right to good design. We have access to so many great designed apps and posters and booklets, but in those countries, we have a lot of poorly designed information. So everyone should have a right to access well-designed information that helps guide decisions and in decision-making. Good design takes time. We need to have time to build relationships in the settings that we work. We need to get trust, we need to get their buy-in, and it takes a lot of time to learn and overcome those cultural barriers that we have already heard from Clara this morning. We can design simple solutions, but they are not simplistic. It is, again, just the simple things that sometimes can help before we have to buy 500 new beds or build a new hospital. Finally, service design is not enough. We could not do this without the big research that the World Health Organization is doing at the same time. The local collaborations that we work with in country and all the other collaborating partners. So service design is just a piece in the picture. Finally, the role of the designer, how has that actually changed in this work? We think that it's very important to leave the design process to them. We need to engage these people in the process, but we need to build ownership from the start for the tools and the services that they design. We use local partners who actually conduct these workshops. It's not us, we step back. We just facilitate and enable. We need to feel with them. We really need to go into the labor ward and see how babies are delivered. And that requires a lot of empathy and sometimes also a lot of strength. But it is really to understand how hard it is to work in these conditions and settings that helps then to think that what actually could help. We design outside the studio, so we don't sit very much at the computer and plan and think, but it's outside in the field when we get ideas for solutions. Finally, we need to be responsible. We are responsible of people's lives when we work in these settings, and this is something that doesn't leave you alone anymore once you've entered a labor ward. So when we talked about the struggle for change, I think service design is a new form of activism. It's not radical. We don't jump on a ship and put up a flag and say, this needs to change. But service design is it's a kind and it's a slow process to help people understand from within what needs to change. And I believe service design is the right approach to go this subtle and kind way. So with this, I want to end my talk. Sorry, I'm late. But I want to say that birth is an experience, and we can design for experiences with good outcome. Thank you.